So let's discuss about the jaundice in this video. Let's see the definition, bilirubin metabolism, causes of jaundice, a classification of jaundice, and clinical features of jaundice in this video. Definition of jaundice. Jaundice is nothing but the yellowish discoloration of skin and mucous membrane due to serum bilirubin greater than 2.5 milligrams per deciliters. Let's see about the bilirubin metabolism briefly. Now, whenever the lifespan of the RBC gets completed, it gets engulfed by the macrophage and the hemoglobin is broken down into heme and globin. Heme is converted into biliverdin with the help of heme oxygenase. Biliverdin gets converted into bilirubin with the help of biliverdin reductase. This bilirubin is an unconjugated bilirubin, and this bilirubin gets excreted from the macrophage into the plasma. Bilirubin binds with the albumin and gets transported. Before it gets absorbed into the liver, bilirubin and albumin complex gets broken down, and albumin remains outside the liver, and bilirubin is taken inside the liver. This bilirubin gets conjugated with the glucuronic acid with the help of UDP glucuronyl transferase and gets converted into bilirubin glucuronide. This bilirubin glucuronide is secreted into the intestine, and with the help of the intestinal bacteria there, it gets converted into urobilinogen. 10 to 15% of urobilinogen from this intestine gets absorbed into the enterohepatic circulation, and from that enterohepatic circulation, 5 to 10% is absorbed into the kidney, and this urobilinogen is converted to urobilin in the kidney and gets excreted via the urine. Urobilinogen present in the intestine gets oxidized into stercobilinogen and excreted via the fecus. Let's see about the types of jaundice. There are two types of jaundice, pathological jaundice and based on the type of bilirubin. Two types of jaundice is seen, that is conjugated and unconjugated, and based on the pathological classification it's three types: pre-hepatic jaundice, hepatic jaundice, and post-hepatic jaundice. Causes of jaundice. Causes are divided into three: pre-hepatic jaundice, hepatic jaundice, and post-hepatic jaundice. In the pre-hepatic jaundice is due to increased red cell destruction. Increased red cell destruction is mostly seen in the cases of hereditary spherocytosis, sickle cell anemia, thalassemia, G6PD deficiency, and malaria. Hepatic jaundice is mostly due to damage to the liver cell or impaired bilirubin uptake, impaired bilirubin conjugation, and impaired bilirubin excretion. It is seen mostly in the cases of viral hepatitis, chronic hepatitis, cirrhosis, and drug-induced hepatitis like isoniazid, rifampicin, pyrazinamide, etc., and ischemic liver. Post-hepatic jaundice is also called as obstructive jaundice. It is seen in the cases of gallstones, parasites, helminthus infections, and carcinomatous infections like head of the pancreas and ampulla of water and bile duct carcinomas. And clinical features are nothing but before jaundice, jaundice is preceded by itching, and abdominal pain is seen. Weight loss seen in the case of chronic liver diseases. Dark urine and pale stools are seen. Pale stools are seen in post-hepatic or obstructive jaundice. Dark urine is seen in the hepatic jaundice. Fever and rigors are also seen in jaundice. Dry eyes, dry mouth, fatigueness is seen in jaundice. So let's see a comparative table between hemolytic, hepatic, and post-hepatic jaundice. So in the hemolytic jaundice, primary defects lies in excessive destruction of RBCs, and in hepatocellular jaundice, damage to liver cells is seen. In obstructive jaundice, obstruction to the bile flow outside the liver is seen. Examples are already discussed. Types of bilirubin increased. In hemolytic jaundice, unconjugated bilirubin is seen because there is increased destruction of RBCs, so more amount of the bilirubin is secreted. This increased amount of bilirubin cannot be conjugated. It is beyond the coping capacity of the liver, hence it remains unconjugated. Hence, unconjugated type of bilirubin is seen in hemolytic jaundice. In hepatocellular jaundice, both type of bilirubin is seen, like unconjugated and conjugated, whereas conjugated bilirubin is seen in obstructive jaundice because obstruction to the bile flow is seen after the bilirubin gets conjugated. Types of serum bilirubin. In hemolytic jaundice, unconjugated bilirubin is seen. Both types are seen in hepatocellular jaundice, whereas conjugated type of bilirubin is seen in obstructive jaundice. Urine bilirubin In urine, bilirubin is absent because bilirubin is not water soluble, hence it doesn't seem to be seen in the urine. And it is present both in hepatocellular and obstructive jaundice. Urine urobilinogen is increased in hemolytic jaundice. It is also increased in hepatocellular jaundice. It is absent in obstructive jaundice due to obstruction. Stool color is dark in hemolytic jaundice because presence of sarcobilinogen. It is normal in hepatocellular jaundice and it is pale because of obstruction and obstructive jaundice. Urine color is normal whereas it is dark in hepatocellular and obstructive jaundice. Serum AST, ALT, and ALP are normal in hemolytic jaundice and they are increased, mildly and markedly increased in hepatocellular and obstructive jaundice. Itching is absent in hemolytic jaundice. It is mildly present in hepatocellular jaundice and marked in obstructive jaundice. Liver is usually normal in hemolytic jaundice. It is enlarged and tender hepatocellular jaundice, and it is maybe enlarged in obstructive jaundice. Spleen is enlarged in hemolytic jaundice because increased destruction of RBCs and normal in other both. Features are also seen in the before slides. Thank you.